A senior lecturer in Māori Health says government departments continue to deny research verifying the health system is institutionally racist. In a study published online in the journal Health Policy, researchers from New Zealand and the United States say people avoid talking about topics like racism and privilege. They're warning there's a risk nothing will improve for Māori. Auckland University of Technology's Dr. Heather Kame told our reporter Leigh-Marama McLachlan that empirical research appears to be falling on deaf ears.
We've done a number of studies through the group I'm involved in, STIR, Stop Institutional Racism, and we've come up with empirical evidence of institutional racism, and then media have covered it, and the Ministry of Health's standard response is to reject the existence of racism. So until such a time as they work out it's okay to admit that there's racism, it's difficult to move forward, because they need to be able to admit that it's going on so that we can begin to address it.
Why do you think that the concept of racism existing in the health system is being rejected?
At the current time, in the current racial climate, people are scared to admit that they're involved in a system that's racist.
Why?
I don't really understand. I think it's best just to say, well, this is what our situation is. This is our dirty laundry. Let's sort it out. I don't understand why people would deny it or not try and address it.
That's Dr. Heather Kame, who lectures at AUT at the Taupua Waiora Centre for Māori Health Research, speaking to our reporter Leigh-Marama McLachlan. We'll have more on this later on Morning Report.